A very good morning to all of you. I would warmly welcome all of you to this World Heart Day celebrations at AIG Hospitals. I'll begin by thanking our chairman, Dr. D. Nageshwar Reddy, our Chief of and Director of Cardiac Sciences, CSR, all the doctors to join us for this World Heart Day celebrations. A very warm welcome to all the dignitaries from the resident welfare associations and corporates who've taken out their valuable time to come and join us. But a big thank you to all the heart marshals who have taken time and joined us today. Thank you very much for today. Over the next 90 minutes, we'll have some very exciting talks about the heart and what you should be caring about. But to begin the day, I would like to warmly welcome our chairman, Dr. D. Nageshwar Reddy, to give the welcome address. Welcome.
Good morning, everybody, and welcome to this function on the World Heart Day at AIG. I think traditionally all these days are designated, for example, like the World Heart Day, to bring attention to a particular problem in a particular specialty. It's now known that, of course, we know heart is probably the most important structure in our body, because once the heart stops, everything else stops in the body. So when the heart stops suddenly, there's a very good chance of reviving it, provided there's somebody there who knows how to revive it. And this is the whole concept of trying to revive sudden cardiac deaths. In fact, every year we know that suddenly 7 lakh people in our country are dying who could have been revived if somebody who knew the basic life-saving systems could actually was around and he could have saved this patient. So based on this concept, our concentration this year has been to see how to empower people to do this, not just doctors, because doctors are not there around all the time. It has to be people, especially those who are looking after the security and so on, who are around most of the time, who should be empowered to do this. So based on this concept at the cardiology department here in AIG, it was decided to train all the important people around this area so that they can be lifesavers. We are fortunate to have one of the best cardiac departments in the country today, headed by the very eminent Dr. Somaraju, who of course everybody knows is a legend in this field. And Dr. Rajiv Menon is there, Anuj Kapadia, and of course the guru of electrophysiology, one of the foremost electrophysiologists in the world today, Dr. Narasimham. So with this very, very strong group of cardiologists, I think it become a responsibility to see that people in the community are trained in this. And I think an excellent job has been done up to now, where I think over 200 marshals have been trained. And I'm sure this will actually cause a significant decrease in sudden deaths, at least in the areas in which they are around. So I think it's a program that has been very well conceived by the department here in cardiology. And again, also I'd like to thank Dr. G.V. Rao, who's coordinated all this. Thank you very much.
Thank you, sir. The next person who's coming in is a personality in the space of cardiology and electrophysiology. A guy who's well known internationally for his contributions in the field of EP, electrophysiology. And he's also the brainchild behind this AIG Heart Marshals. Ladies and gentlemen, please put your hand together for Dr. Narasimhan, who's our clinical director and HOD of EP.
Thank you very much, Kepri. It's a very important day. I would at the outset like to thank everyone for assembling here. And the purpose of, can I have this? The purpose of putting together this kind of a meeting is to emphasize the importance of a bystander recognizing a cardiac emergency and getting them to the hospital. So if that is not recognized, then you may have the best facility, but nothing gets done. Heart disease continues to be a major problem even today. Most of the deaths, especially sudden deaths, continue to be because of cardiac disease and sudden cardiac death, either because of an acute vascular occlusion, a vessel getting occluded, or an electrical problem results in sudden death. What we have realized is this can affect the young, the old, men, or the women can succumb to sudden cardiac death. And there have been eminent personalities who have brought attention to this fact, where in a sports field, people have suddenly collapsed. In the pink of health, they have been doing everything normally and then suddenly they have collapsed. If only they have been resuscitated, they would have been fine, because there's almost a 50% chance that a condition like ventricular fibrillation can be resuscitated immediately. And it doesn't involve very expensive or highly technical stuff, but a simple bystander CPR will be able to resuscitate at least 50% of these patients who succumb to sudden cardiac death. This is sent by one of my friends in Calcutta, a person who was going for a morning walk, and he suddenly collapsed, and the whole crowd is waiting around. They were worried about the implications of a police inquiry and so on and so forth. They didn't recognize this person had succumbed to a sudden cardiac death. This is a common plight in every major city in India. Now, why is this important? If you look at it, here is the time. For every 1 minute delay in resuscitation, you have about 10 to 20% drop in survival. So you may be able to recognize and bring this patient to the hospital after 15 minutes, but the chance of this person surviving is practically zero. So if there is a sudden cardiac arrest, the person who is next to him, either in the housing complex or on the road or on the gym, he is the right person to resuscitate this person, because without that, he won't even reach the hospital. And that is what we are trying to put together, a mechanism where people in and around AIG, should there be a catastrophe, it is promptly recognized and they are brought in for the necessary care. And what I'm showing you here is the blood pressure that is generated by a chest compression. So you can see the chest compression generating in a person who has had a complete cardiac arrest. Each chest compression generates a certain amount of pressure for the blood to perfuse the brain. The moment you stop compression, immediately there's a drop in the blood perfusing the brain. So chest compression is the only thing that a person needs to do till such time the person reaches the hospital. Now, having said that, the problem is very simple. But why is it that it is not practiced? At least in our country, the major problem is the problem of worry about a medico-legal implication. What will happen if I do? Will I be taken to the police station? So on and so forth. Thankfully, there has been this Good Samaritan law, which kind of absolves you of all the responsibilities if you have only taken the immediate action in the right spirit. And the second step is what we are stepping in to do now, to empower the population in and around or in our local communities so that they'll be able to provide the necessary care so that the patient survives the acute event. There are set COVID protocols which are now emphasized in every single resuscitation algorithm, and all the trainees will be emphasized in terms of safe resuscitation protocol. Now, cardiac arrest is not the only problem. This is what you're seeing here is, if you have a person with a chest pain and it's appropriately recognized as a heart attack, within the first few hours, if you don't do anything for the person, you lose all the heart muscle after 6 to 12 hours. So you might have made a brilliant diagnosis of a heart attack, but at that time, the commonest problem as cardiologists we have is, my daughter is in the US, my son is in UK, my cousin is XYZ, making phone calls, delaying the whole thing. Every single minute you delay you have a valuable amount of the cardiac muscle that is lost. So this is an example of a blood vessel that is completely blocked, which is supplying a large portion of the heart. And just with a simple medical therapy or a blood thinner, this vessel can be opened, provided it is done on time, because time is muscle. There are several cardiovascular emergencies where recognition is key, and the first responder is going to be the most important person in recognizing the problem and bringing it into the hospital. Having said that, we have our own set of problems. This is the traffic that is snarling in our street, and we are going to have our own set of problems. So bystander CPR at the site of cardiac arrest is more important to make some tangible benefit in this area. Over several decades, you have had very archaic medical treatment, or sitting and praying, and very, very crude form of medical therapies that have evolved over the last 2 or 3 centuries to a very high-tech medical therapy nowadays, where you can exactly quantify the amount of block. We have robotics which can offer the therapy at a very precise place and location. These things are available within these 4 walls. But having said that, it works only if the patient reaches the hospital. So if these things are not recognized, you may have the best therapy available, but it's of no use. And that is what we try to bridge now by empowering the community to recognize the symptoms of heart attack or cardiac emergency, which can be recognized early. And when you're in doubt, please check it out. This is common even among physicians. We have a reluctance to accept that we have a cardiac problem. The commonest ailment, I have some gas, I take some gas medicines, and then come after several years when the damage is done. And each of these will be followed with a clear action plan how to execute that. And only appeal is, please do not delay when you suspect there is a cardiac problem. Rush to the nearest emergency room, get it at least confirmed or ruled out so that you can have the appropriate therapy. Thank you very much.
Thank you so much, sir, for a very insightful talk. I think we should all be prepared for an emergency and act upon as stated by sir. Next up, we have another eminent cardiologist, Dr. Rajiv Menon, who's also our Director of Cardiac Sciences. Sir would be talking about warnings from your heart.
Morning, everyone. Thanks for this opportunity, and very good World Heart Day to all of you. Sure, all of you will agree with me that I have an unenviable opportunity of actually talking after Dr. Narasimhan's talk. I didn't go through the program. Otherwise, generally, I don't agree to talk after Dr. Narasimhan, because most of the people actually go off once Dr. Narasimhan has spoken. Anyway, having said that, I think I have some experience in doing that also. So hopefully it will be helpful to all of you. Today, over the period of next 10 to 15 minutes, what we'll try to do is look at some of the symptoms which Dr. Narasimhan was mentioning. We should not ignore, we should not forget to give importance to that. And looking at certain basic aspects of about what a heart attack is, what a cardiac arrest is, how do we actually differentiate this? I'll just start off with a case vignette. So this was actually a real case. This was a 45-year-old male. He had some burning behind the breastbone, so what we call as a retrosternal burning. He went to a pulmonologist, lung doctor. He said, don't worry, this is nothing, you actually go home.
The patient insisted that there is something abnormal and it doesn't look safe to go back home, and he wants a ECG to be done. So he took a ECG, and then the technician told him there's something abnormal in the ECG, don't move, and we will inform the doctor. So he immediately called up the pulmonologist and told him there's something abnormal in the ECG. The pulmonologist was very upset. He actually shouted on the technician and told, you have no sense, and why are you telling all these things? The doctor's responsibility to decide whether the patient has a heart attack or not. And just to prove you wrong, he said he asked the patient actually to climb up the stairs, and that will prove that he doesn't have a heart attack. So he was, I think, on the 4th floor or something. Said, you please come walking upstairs, and then it will prove that you don't have a heart attack. What happened? Actually, patient started climbing stairs, had a cardiac arrest, and collapsed on the 3rd floor. What do we learn from this? Retrosternal burning. Kindly do not ignore this. Actually, the other day we were just joking around. We have a national animal, national emblem, a national song, national anthem, all that. If there is a national disease which is anytime told, I think that will be gas. Because anywhere, whether it's Kashmir or Kanyakumari, anywhere you go, whatever the problem, even if the patient has a knee pain, he'll say probably it is because of the gas which I am happening. Kindly remember, ladies and gentlemen, that gas can be extremely dangerous, and what people have been thinking as gas for a long time could be actually the first warning sign of a heart attack. So kindly do not experiment, and make sure that you meet a sensible doctor who actually comes to the proper diagnosis. Now, what are certain terms which doctors keep using and confuse the public even more? Somebody will tell angina, ischemia, heart attack, somebody will say cardiac arrest, somebody will tell heart failure. Very briefly, what are these things? So if you look at heart attack, that is in medical terms called as a myocardial infarction. Now remember that the vessels which supply the heart are over the heart, not inside. And this is how the blood supply to the heart muscle goes, which we call as myocardium. And slowly, because of multiple risk factors, there can be a blockade which develops, includes fat, cholesterol, other materials. As it narrows, the patient starts developing some chest pain while walking or exerting, referred to as angina. When it completely stops, that means the circulation completely stops. Initially, just with exertion or with heavy diet or during stress, you might start having that issue. But in between, it can cause what is called as a plaque rupture. So this is a plaque. Now, when it breaks, then the blood is directly in contact with that particular plaque, and that can actually produce a blockade, which we call as a heart attack. So the cartoon, after some time, you will actually see that there is a rupture there, and that produces a complete blockade of the. So the narrowing produces only pain or discomfort while walking, but a sudden blockade actually produces a sudden heart attack. So this completely closes the vessel, and the muscle starts dying, and over a period of time gets completely destroyed. So time is muscle. That's what Dr. Narasimhan was mentioning, and it's important that you don't ignore it. And this entire area gets damaged, and the heart starts, the heart function starts coming down. Then all the other problems start because of that. Now, compared to that, what is cardiac arrest? Cardiac arrest is where the patient has collapsed. That means there is complete cessation of heart beating. In heart attack, there is damage to the muscle, but the heart has not stopped. But when a patient has cardiac arrest, then there is a complete cessation of circulation. So there is no blood going to the brain, kidney, liver, lungs, and there is complete cessation. And immediately you need to react. To have help, try to call for an ambulance and start the CPR, which I think the Marshals who are sitting the rows, they have actually learned over a period of last couple of days or last 1 week. And this itself is sufficient. One of the major problems which initially CPR had was the mouth-to-mouth respiration. So we used to be taught during our MBBS days that when you are doing a cardiac massage, after every 5th massage, you should actually go and do mouth-to-mouth respiration. So people used to be afraid, unknown person, you try to do mouth-to-mouth respiration, what infections we are going to get. That was a great hindrance. Now we have conclusively proven that just doing cardiac massage, that is sufficient to increase the survival of the patient. You need not worry about mouth-to-mouth respiration. Till the ambulance arrives, some doctor comes, ER physician comes or a tech comes, and then starts a advanced resuscitation protocol, just continue massage. Whatever way you can do, the best way of doing it is demonstrated here, but whatever way you can do, some circulation will be maintained. Finally, what about heart failure? So heart failure is where there is fluid accumulation in the body. So we said heart attack, muscle has got damaged, cardiac arrest where the heart has stopped, and heart failure is where there is the patient actually bloats up. There can be increase in weight, patient has breathlessness, the legs start getting swollen, patient is not able to lie down, patient is not able to walk without breathlessness. So those are the symptoms of heart failure. So there are certain colloquial terms which are used interchangeably, but they are not same. Now, what are the symptoms when you have heart problem? You can have chest pain, you can have breathlessness, you can have palpitations. Again, people will say dadalaga anpistundi, weakness anpistundi, swelling of feet, a faint. The first symptom of a cardiac problem could be that the patient has actually fainted. Now, there can be certain atypical symptoms also, like for example, patient can have nausea, patient can have vomiting, complete giddiness, any of uncommonly they can have significant fatigue, weakness. Any of those things can be a sign of impending heart problem. What are the challenges? You can have pain just behind the chest rather than on the left side. So unfortunately, if you see all the movies, whether it is Bollywood or Telugu movies, you will see that whenever somebody has heart attack, they'll put the hand over the chest on the left side. Unfortunately, that is not right. Actually, it is the center. It is not on the left side that a pain of heart occurs. It can occur on the left side, but most commonly it occurs behind the breastbone. So if they would have shown everyone having chest pain like this, probably more people would come to a doctor when they have that type of retrosternal burning. Commonly confused with gastric problem. This we see day in and day out. When in doubt, always treat as cardiac. Now in diabetics, a word of caution, they may not have any symptoms at all. They may not have any chest pain. That's the reason why it's extremely difficult to actually diagnose heart problem in diabetics. They can have referred pain. So say somebody has been having shoulder pain for a long time. When he starts having angina, that pain might be referred to the shoulder. So he just ignores thinking it's a musculoskeletal pain, but actually what he's having is actually a cardiac pain. So these are all the places where the patient can have pain. Retrosternal, it can go to the neck, it can go to the jaws, it can be epigastric, that is near the stomach. It can radiate to all the areas, or it could be even in the back. So any of these pains you should not ignore. Now, just to re-emphasize how important it is to take help of a doctor or a cardiologist. A very famous cardiologist actually, who is known all over the world, who retired from a premier institute, when he started having chest pain, he thought it is gastric. He was actually carrying his luggage in the airport and started having pain. He thought it is gastric. He took pantoprazole. He did not respond. After 24 hours, again he had recurrence when he landed in Delhi. He still thought that it is not cardiac. He was flying to Hyderabad for a talk. He came to Hyderabad when he had recurrence. He wanted to rule out a cardiac issue. When he took a ECG, already had an evolved heart attack. He had an evolved myocardial infarct. So this is a premier cardiologist who had difficulty in diagnosing symptoms. So imagine for someone like you and me, how difficult it will be to differentiate a cardiac from a gastric issue. So that's the reason why always remember, when in doubt, kindly rule out a cardiac issue. What are the simple do's and don'ts? Immediately seek medical attention. You can use sorbitrate, which dilates the vessel. You should take it in a sitting or lying down position. Don't take it standing. Take aspirin chewable, which is a blood thinner, which helps in opening up the vessel. Loosen your clothing. Go to the hospital in ambulance. Many of the cardiac arrests occur in the first 1 hour. So at that time, you are just in a car and there is nobody to do resuscitation. You lose that golden opportunity and start the cardiac massage whenever there is a cardiac arrest. Do not exert. So suppose you go back from this meeting, you have retrosternal burning. Now you have just heard that it could be cardiac. Now don't experiment with yourself. Let me climb one floor and then see whether I collapse or not. Kindly do not do it. Okay? Go to a hospital, nearest hospital, at least take a ECG. Do not smoke. Some people actually in stress, they start smoking. They are having burning. Am I having heart attack? So they start smoking. Do not do that. Do not give food. So burning is there. Give some milk and all so that it comes down. Do not postpone medical attention and kindly do not refuse admission. Please remember the doctors are here to serve you. Do not think they are here to just make money. right? If somebody has advised you admission, it is being done with a good idea. So kindly don't think that just because the doctor will make few pennies more, is advising you admission. There will be some reason. If you have doubt, you ask the doctor, why do you think I should get admitted? He'll explain to you. But don't again do a Google search from the emergency and think that it's not cardiac and then go back home only to drop down dead. That's extremely important. It's a question between life and death. Do not ignore symptoms because ECG or blood tests are normal. This is again a common problem. You advise admission, the patient will tell, okay, fine, my ECG is normal, doctor, my blood tests are normal, why should I stay? I'll go back home. They do not mean anything. The only thing which determines whether it is cardiac or not and whether you should be in the hospital or not, the symptoms. So based on the symptoms, the doctor advises you, so do not go against that advice. Now, all of you will be on WhatsApp and there will be a lot of WhatsApp messages which will be going on for a quick cure to heart attack. So you have heart attack and you jump or you dance or you shout or you laugh and some funny things like that and you'll stop the heart attack. There is nothing like that. Kindly ignore all those WhatsApp messages. The only way you can save yourself is to come to the nearest hospital and get treated. So ladies and gentlemen, the take-home message from this talk would be, symptoms of heart disease can at times be subtle. Recognizing the symptoms helps in seeking early medical attention and prevent irreversible damage. A muscle which is lost can never be brought back. Many times it may be impossible to differentiate gastric from cardiac causes. Even a cardiologist may not be able to differentiate. Kindly do not use your intelligence or Google searches to make those differences. Cardiac arrest needs immediate attention and prevention of heart disease is the best strategy for morbidity. Thank you so much for your patience.
I think all of you would agree with me in that just standing there, I felt a little bit of pain. Just hearing you talk, but I guess it's all gas stuff. But thank you so much, Dr. Rajiv, for this insightful talk. I think we should be very attentive to listen to our bodies and not try out any stunts. I think we should come and tend to the emergency or come to a cardiologist for our symptoms. Thank you so much for that, Dr. Rajiv. I think next up, I think it's time to felicitate the trainers, the people who've trained more than 250 plus AIG Heart Marshals. And to felicitate them, I would request a person who needs no introduction, a person who's the father of cardiology in Hyderabad, who's also chief mentor and patron at Department of Cardiology at AIG Hospitals. Ladies and gentlemen, a warm applause for Dr. B. Somaraju. So, if you could join us. And I would like to invite Dr. Saranya. I think Dr. Chandrasekhar can also join us. Dr. Ankit. Please. Dr. Kalyan. Now, we'll also like to call Girija Kumar, who is our EMT, Emergency Medical Technician. He's also helped us a lot. Thank you, Girija. Please come. So, stay back. I would also like to request now our chairman, Dr. D. Nageshwar Reddy, to join us, as well as Dr. G.V. Rao, our director, to come on the stage. We'll now like to felicitate all the office bearers of the various resident welfare associations who've supported us in this program, as well as the senior management from the corporates. So without you, we couldn't have achieved this feat, and we'll continue doing more and more of this in the days to come. First up is a community which is right our neighbor, who's endured us during the construction time. Ramki, please, if you could request all the office bearers from Ramki to step up, please. So I think we have with us Miss Priya Rajendran, hi, please, Miss Sridevi and Miss Shirisha. Yeah. Next up, I would request the office bearers from L&T Serene County, Mr. Ramesh Marda, Ms. Nidhi Srivastav, Mr. Atul Kulkarni, and Ms. Nagalata Rani. Please, if you could join us. Thank you. Sure, please. Please, sir.
I want to give you a little surprise. I'm from Kurnool. You are from Kurnool. I have paid you in my child. Dr. Somaraju sir, I am brother of Dr. Mahesh Marda, elder brother of Dr. Mahesh. My brother was classmate, studied with him. When we were children, the principal of the medical college used to be Dr. Bhaskar Reddy Garu. You need no introduction because he was Nageshwar Reddy Saab's father. At children, we have seen him also. Thank you so much, sir, for organizing this. Very happy. 24 of my marshals here. Will you just stop? Really enjoyed.
Thank you so much, sir. Next up, I would request the team from HSBC to please step forward. Thank you, Mr. Prasad and Mr. Anderson, for coming up. Thank you. Next up is Minakshi Bamboos, Mr. Sairam and Ms. Poonam. Please step forward. Thank you. Next up, I'll request the team from Rainbow Vista, Mr. Ramarao and Ms. Shweta to step up, please. Next is the team from Hillridge Springs, Mr. Suresh Agarwal and Mr. Kamlesh Agarwal. Sorry, my bad. Ms. Kamlesh Agarwal.
For the AIG management for this organizing this beautiful program. The, the, the Marshals paid for our community. We are very much grateful. हम आपका बहुत सम्मान आपने जो अपॉर्चुनिटी है इसके लिए भी बहुत बहुत आप सभी का धन्यवाद. Thank you very much.
Thank you so much, sir, for your kind words. Next up is the team from Botanica, Mrs. Harita and Mrs. Bandhana, please. Last but not the least, I would request the team from Salarpuria Satwa, Colonel Nasser Hussain and Mr. Sudhanshu to join us, please. Thank you. Thank you, sir. I would now like to request Dr. B. Somaraju to address the.
Before Dr. Somaraju comes, just want to thank all the community office bearers and leaders for being broad-minded enough to let their staff get trained in this, because this is, I think, a life-saving thing which they have done. Thank you.
Morning to all of you. Adding to what Dr. Rajiv said, don't neglect any chest discomfort or warning signal. Most important clue, I would say, is first time in life, you feel something unusual, which is different. Suppose you are 40 years or 50 years, 60 years, you are already experienced. First time in life, feel something different in and around the chest, right from upper abdomen to the lower jaw. Always go to the emergency room. First time in life. Or anything that wakes you up, sleep. So anything that wakes you up and sleep, whether it is a chest discomfort or a headache or abdominal pain, so that nocturnal or nighttime symptom has a serious significance. Second thing I just wanted to point out is, when somebody collapses, don't make them sit. That Narasimhan showed a photograph. Let them lie down. Actually, when they lie down, even if you don't do anything, they recover. But don't make them sit, they will never recover. Because blood flow to the brain stops. That are things I wanted to point out. And the other thing I wanted to say is that Nagesh already said, heart is the most important organ. Not, we used to believe. That's the reason why I took cardiology when we were students in 1960s. But now we realize heart is simple muscular pump. The most complex and important organ in the body is the intestines, the gut. Chandigarh, in a lighted manner, we used to say, "Tatti ka doctor hai." But now we know the gut is most complex, most important organ. It affects all organs of the body, and including the brain. Heart, obviously, because the food we eat is medicine that affects you lifelong. There is a saying that behind every heart attack, there is a very good cook as a wife, and it is transmitted through the gut. So thank you.
Thank you so much, sir. I think we have a few more office bearers, sir. If you can continue, Dr. Somaraju. We have from Indu Fortune Fields, Mr. Rajendra Prasad and Mr. Satish. Please, if you could join us, sir. Thank you so much. And from Telapur Neighborhood Association, we have Mr. Ramana, who's the president there. Thank you, sir. Thank you. I think now is the time to recognize the true heroes, our AIG Heart Marshals. I think these guys deserve a special applause from all of us. These guys are there, and we'll be handing over a special badge of AIG Heart Marshal to all of them. I would request Dr. Narsimhan and Dr. Rajiv, probably on either side, to recognize 10 of them.
Sorry, come back again. And on correction to what Capri said, actually, he called me chief of cardiology. Actually, I am no longer the chief of cardiology. Dr. Rajiv is the chief of cardiology.
I would request Dr. Narasimhan and Dr. Rajiv to hand over the badges. Thank you. Thank you. Thank you, guys. Thank you so much. Next up, I would request Dr. G.V. Rao and Dr. Anand Gupta to please come up to felicitate the next set of people. I think 2 rows can come in, please. The second row, please. Thank you so much. Next up, I'll like to request Dr. Prasad Reddy and Dr. Naveen Reddy to come up, please. Sir, we have. Up, I would request Dr. Anuj Kapadia and Dr. Swaroop to do the honors, please. I would request Dr. Sachin and Dr. Daljit to step up, please, for the next round. A lot of girls, I think. Special round of applause for all the girl power. Thank you. For the next batch, I would request Dr. Sridevi and Dr. Uday to step up, please. I think for the last batch, we'll request Dr. Oras Atre and Dr. Suresh to step up, please. Thank you. Suresh is not there. Dr. Siddharth Pani, our medical superintendent, please join us. Thank you so much, everybody. So, a big thank you for all of you. Your certificates would reach your respective uh, corporates as well as the RWAs. As Dr. Daljit just pointed out, I think the journey has just begun for you. Saving lives is our ultimate goal, and I think all of us should work together for that. So now I would request all of you to step up, also the office bearers of the RWS, for a group photograph with us, please. Please.
Thank you so much again. Once again, I think this entire thing has been initiated by Dr. Narasimhan. I should thank Dr. Narasimhan for this conceiving this idea, and all the team members of AIG, the operations team, the security team, who have cooperated and have done this fabulous job. I thank all the housing society members for making use of this and then training their security people with us. Thank you so much. I thank all the office bearers and all the staff at AIG for this excellent job that they have done over the last 1 week, 10 days training about 200 heart marshals. But overall, they have trained about 1,000 heart marshals as in today. Thank you so much again. I request all the office bearers and the doctors to join us for lunch. Thank you so much. And as a special appreciation, I think I should give a token of memento to Dr. Narasimhan for conceiving this idea. Narasimhan, please.
Thank you so much, sir. With this, we come to a close of the ceremony. As Dr. GV said, we will have lunch for the security team, and all the AIG Marshals is organized outside the auditorium. For the office bearers and all the doctors, it's on the 5th floor in the library lounge. Please join us for lunch. Thank you. And Dr.